Today on Ask Dr. Moore, I'm going to answer another viewer question in regard to my ankle ligament repair video. Can an old ligament tear and an ankle injury be cured by surgery? And the answer is a resounding yes. In fact, most ankle injuries that are a grade 1 or 2 are treated with a cast or a cam walker, patients in 90 degrees for about 3 to 6 weeks. The ligaments scar in and they have up to 90% of tensile strength from the original ligament before the tear. But if you have instability, residual pain, ankle gives out, and it's a positive MRI and you've had a visit to the surgeon's office and you're a good candidate, the repairs are very simple. Like the video, you can have a end-to-end mid-substance tear repair, or you can have something that's pulled away from the bone where we use a bone anchor, or additional material to reinforce the ligament. 3 weeks of minimal walking to non-weight bearing, and then physical therapy, maybe an ankle brace to support it. And at 6 to 8 weeks, when the tensile strength is really strong, which means the fibers can take aggressive pulling, any type of exercise is doable, starting with walking, increasing to walk and jog, things of that matter. Tennis, things of that nature, I would lean more towards physical therapy to get those lateral, anterior, medial, and posterior muscles coordinated and strong. Again, hopefully that was helpful. If you have any other questions, you see any other videos on the YouTube channel, please submit them and I'll do my best to answer them. Again, thanks for tuning in. Stay healthy and one step ahead.